Hello, my name is Dr. Elizabeth Steinberg, and I'm a pediatrician, and today I'm going to talk to you about fever. Fever is one of the most common symptoms treated by healthcare providers taking care of children, as well as parents or caregivers at home. It can be very concerning because it can really alter temporarily your child's well-being and behavior, and can be very disturbing for parents to take care of a child with a fever. However, by appropriately treating your child with fever-reducing medication, they usually do perk up, and it's one of the most exciting treatments for children because they do really well with medication at home, such as Motrin or Tylenol, and drinking fluids. So fever is defined as anything over 100.4 Fahrenheit. And it's important to document the fever to be 100.4 because technically 100.0 is an elevated temperature. It's not a fever. So elevated temperature can also cause us to have some abnormalities in our behavior and how we feel. But it's important because we spend a lot of time with how we diagnose children based on the fever. Is the height of the fever important? It can be. I've seen children who have a temperature of 105 Fahrenheit, very happy and calm. And then I see children with 101 temperature and they look terrible. So the height of the fever can be alarming, but just one temperature being very high or two temperatures in a row being very high may not be as concerning. So always look at how your child is acting and how they're feeling, and also when they get the medication, how do they recover when they get that medication. That's your best indicator on if your child has a fever and are they okay or not. Is look at the child and see how they're feeling. So there are some myths about fever. One of them is that you can get a coma or a seizure from having a fever. There is a condition, febrile seizures, that could happen, although it is rare. So it is unreasonable to think that because your child has a fever, because of the height of the fever, that they're going to get a seizure. That's not necessarily true. But it is important that if you do have a pre-existing seizure disorder to treat fevers, as well as any abnormality, electrolyte abnormality with a seizure disorder to correct that abnormality. So how do you treat a fever? So by documenting the fever, it's important. You should document the time that the child has, the mood of the child. Are they tired? Do they look lethargic to you? Are they happy and they have a fever? So documenting how the child appears at home and the time that they have the fever. You could check temperature by rectally, orally, under the arm, around the forehead, or in the ear. And all of these can be effective, and they're usually correct. If you get a number that seems very off to you, check it again. Or if the child was running around and now they feel really hot, let them cool down and check it again. So checking the temperature is very important, documenting it and how the child is feeling. For children over the age of 6 months old, 6 months is the cutoff, they can have Motrin or ibuprofen. For babies less than 6 months old, they can have Tylenol. Now, a special category of babies is newborns. Newborns cannot have a fever at home. If they have a fever at home, you call your pediatrician and discuss about where to go with the newborn to the hospital. Newborns less than 28 days should not have a fever at home, and it needs to be taken seriously. Again, that number is 100.4. So even if you have an elevated temperature in your newborn baby, you should call your pediatrician to discuss what to do. But older than 2 months old and 6 months, they can have Tylenol. This dose of Tylenol should be discussed with your pediatrician because most of the time, even infant Tylenol can be, it may say on the bottle not to give to the baby unless you discuss with your pediatrician. So your pediatrician will give you a weight-based dose to give to the baby who's between 2 months and 6 months old. And older than 6 months, they can have Motrin or Tylenol. So let's talk for a moment about babies older than 6 months older who could have Motrin and Tylenol. So what I recommend doing is documenting the temperature, the mood of the baby, and the time. Then with that information, you decide to give Motrin or Tylenol. Can you give both? Yes. I do not recommend giving both at the same time, but it is safe to do so. And the reason why I don't recommend giving both is because if that child or infant still has a fever in an hour, you have nothing to give them. So what I recommend doing is after you taken your time and temperature and mood of the baby, you give Motrin or Tylenol. And then you give the baby or the child enough fluid, let them drink fluid. And we could talk about how to get fluids into a child in another video, because that is also very exciting information and you could do that at home very easily. So what I recommend doing is giving them the Motrin or Tylenol with water, and then in an hour time, rechecking the temperature. If they're better, great. If they still have a temperature and it's going up, you can give the other medication, like the Tylenol, if you gave the Motrin first. And that's something else to pay attention to, is writing down what you gave them initially, because in an hour you can give them the other medication. Then if they're still having a temperature, you can give them medication. If the fever is trending down, you may want to wait a little bit. You may, just because it was 102 Fahrenheit an hour ago and now it's 101 and they still have a temperature, but they're looking much better, it may be reasonable to wait and not give them any medication and see how they do. But you can at that time give them the other medication. Tylenol is given every 4 to 6 hours, and Motrin can be given every 6 to 8 hours. I recommend spacing it out to the furthest amount of time. So Motrin only giving every 8 hours and Tylenol given every 6 hours. If you need to give the medicine more than that, then you should call your pediatrician to discuss why you think, and why does the pediatrician think that you're giving the medication so much. It's reasonable for a child to have a fever for 3, 4, 5 days even, but that's not something that you should have to handle by yourself at home. So discuss with your pediatrician about what else is going on. And also keeping in mind that a fever without any other reason can be concerning and needs to be properly evaluated. If you have any other concerns about fever, please let me know.